Uh-oh, guess what day it is? Guess what day it is? Huh? Mike, what day is it, Mike?
Hello, I'm Michael Andrew Weston, and welcome back to Hump Day Health Talks. Today, I'm so excited to have somebody who has not been on here with me yet. I'm really excited to have one of our resident behavioral health specialists, Leslie Green. So good to have you. Of course, it's Mental Health Awareness Month, and we're talking about things that impact our communities, our populations. And one of the major things that we're seeing a lot of now is ADHD. I want to first ask you, what are some of the signs of ADHD?
Well, I'd like to start off by saying first, ADHD impacts adults and children. Some of the signs that come along with ADHD are impulse control, lack of attention, emotional dysregulation, poor attention to detail. For children, it could be disruption of academic school functioning. For adults, it could be social impairments. ADHD can mimic a lot of things because children are working through their development. Their prefrontal cortex is not fully developed. So we have to be very careful with diagnosing children with ADHD. It could just be a child who's just very rambunctious. So before we make that diagnosis, we have to look at their diet, their environment. And when we look at those things and rule out medical causes, we pay attention to their academic skills, like are there any learning delays, and go from there.
I think that's important. And one of the parts that you mentioned, and we're gonna talk about adults in a minute, but there was the component of emotional regulation. That was one of the things and I think about children. It's like children in general are often just emotional, and so also using that as a measure. Oh, they're emotionally unregulated, where they're a kid. And so, how would you say we go about like monitoring that with children specifically, since children tend to be emotional people, characters?
Well, there are certain milestones that we can measure that are charted through their physical health charts. So, with that being said, there are certain factors that we could look at. For instance, if we have a school age child who's about 5 years old, they should be able to emotionally regulate to some degree. They have been, of course, weaned off their bottle, they've been potty trained, so they should have some degree of independence. So, with that being said, if they're in school all day long, they've learned to get through the school day sufficiently. But if there's a kid that hasn't learned to do that, they're acting out, they're emotional, they're up under a desk, they're often problematic. So there's the difference between the two kids. ADHD is often overlooked because women are not so hyperactive. Men, yes, you can tell with men, it's all this testosterone. So with women, it's more of the inattention, the emotional dysregulation, frustration, and can also mimic anxiety for an adult unable to work properly throughout their workday. They frequently need to take breaks. They're unable to complete daily tasks. They're frequently being told that they're not completing certain tasks. That's probably about the gist of things. If you're not able to sustain focus, you're not completing tasks, and you're not making the mark when it comes to completing necessary assignments, whatever has been assigned to you. ADHD is a superpower, so please seek out help, and you're not alone.
Well, thank you so much.
You're very welcome.
Thank you all so much for tuning in to another Hump Day Health Talk, and I'll see you next time.